Welcome back to What in the Health with your co-hosts Fatiha and Rena. Today, we have the absolute privilege of having Dr. Raegan McDonald-Mosley on our podcast today to talk about reproductive justice, specifically when it comes to navigating post-Roe America. We know that this has been a time of immense grief, confusion, and a myriad of emotions since the ruling this past June. It was important for Rena and I to create an episode with an expert who has made impactful strides in reproductive justice, which is why we are really grateful to speak with Dr. Raegan. Dr. Raegan received her medical degree from the University of Pennsylvania and completed her postdoctoral training in OB-GYN at the New York University Medical Center. She has also completed a specialized fellowship in family planning at the Johns Hopkins University School of Medicine, during which she also obtained her master's in public health from the Bloomberg School of Public Health. Throughout her career, Dr. Raegan has worked in global women's health and reproductive justice, with notable roles at both Planned Parenthood of Maryland and Planned Parenthood Federation of America, where she served as chief medical officer for both entities. Currently, Dr. Raegan is the CEO of Power to Decide, an organization that ensures that all people have the power to decide if, when, and under what circumstances to get pregnant and have a child. Thank you so much, Dr. Raegan, for taking the time to be on our podcast.
Thank you so much for inviting me. I'm super excited to have this conversation with you all today.
Great. So before we start, we like to do this little thing just to check up on how everyone's doing. Dr. Raegan, on a scale of 1 to 10, how are you feeling today?
Today, I'm feeling pretty good. I'll say a 9. The sun is out. It's a beautiful day here in Baltimore. And despite the enormous challenges in the world right now, I'm feeling quite hopeful.
I definitely appreciate your optimism. I feel like that's exactly what you need, especially when you're gearing up to have really tough conversations. So thank you again for being here. We did want to kick off our conversation today by laying the foundation of what it means to be an ally for reproductive justice. I think often when people hear the term reproductive justice being thrown around in the media, news cycles, or even social media, they immediately think about access to abortions. And now Rena and I, we both know that reproductive justice is more than just access to abortion, but we would love to ask you what reproductive justice means and really talk about what other topics fall under this term collectively.
Yeah, I'm so glad that you asked this, because I think that people often throw around the term reproductive justice a lot without really a full understanding of what it means. Moreover, people often conflate, right? Like the terms of reproductive health, which is sort of what happens in the healthcare system, the work that I do as a provider, and reproductive rights, which is sort of the legal advocacy work and making sure that the laws are aligned for people to have access to reproductive health services. People conflate those terms often with reproductive justice. The reproductive justice movement was actually founded by Black women and emerged in response to the history of reproductive oppression in our nation, and in recognition of the fact that the broader women's rights movements of the 1990s, when reproductive justice was established, was largely led by and representing the concerns of middle class and wealthy white women, and did not center the needs of women of color and other marginalized women and trans and non-binary people. The reproductive justice framework is based on the global human rights framework and seeks to center women of color in discussions about reproductive rights and health in their own communities, and really truly is an organizing principle. I often refer to the definition of reproductive justice provided by Sister Song, which is one of the founding and premier reproductive justice organizations. And it defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Loretta Ross, who was one of the original co-founders of Sister Song and a key architect of the whole reproductive justice movement, was actually just named a 2022 MacArthur Fellow and given one of their prestigious Genius Awards, I think just this week. So it's wonderful to see one of the RJ leaders receiving her flowers and seeing this movement and this framework really coming to the highlight in the forefront.
Yeah, thank you so much for giving our audience that context. And I'm so glad that you mentioned the work and the credit that Black women and women of color need to receive when we're having the conversation about reproductive justice, because so often in multiple aspects of public health, mainstream media gets really caught up on different events that are happening in the world, but we rarely acknowledge the origins of how these movements have started and really the backbreaking labor and sacrifices that women who are already marginalized in society have taken upon themselves to continue. And I think having that disclaimer in the beginning of our conversation is important for our audience, because more than likely they probably don't know this because it's not talking about in day-to-day public health conversations. But I also hope that it encourages people to look up the work of Sister Song, like you mentioned, and really understand the history of all of this.
Yeah, absolutely. It's a framework that I've tried to learn a lot about and apply both to my clinical work as well as the work I do at Power to Decide, which is more in the healthcare communications and digital space. And it's really a guiding principle. And as I stated, an organizing principle. And I'm so grateful to the Black women and leaders who brought this to fruition and have really worked to make this framework further inculcated in our healthcare systems, in our reproductive rights organizations, and in practice.
Now that we've beautifully kind of laid the context of what reproductive justice means from a healthcare, social, cultural, and historical perspective, we wanted to gear this conversation more towards the recent rulings that have occurred in the Supreme Court in June and talk about how this ruling impacts people, not just women, but really anyone that has a uterus, people that are looking to have children, and people who are not looking to have children.
Yeah, so we wanted to talk a little bit about your background since you work so much in reproductive justice. How did you process the recent Supreme Court ruling and all the conversations about it in the media?
Yeah, honestly, it's hard to process and wrap my mind around. I can't help but wonder how such smart, accomplished people could set the course for such terrible policy decisions, right? I think it's worth noting that it's the first time in all of American history that the Supreme Court has ruled to diminish or take away rights for American people rather than ruling to increase them. And they did it, for an issue and in a manner that will cause devastating health, economic, and social consequences for people who are already underserved and have been historically marginalized in this nation. So as someone who sort of dedicated my career to improving the reproductive well-being for people, particularly those with the most barriers to access and care, it's unconscionable to me, right? That we would make these deliberate policy decisions that are going to make it harder for people to access essential healthcare services. And in fact, to make it harder for people who are already underserved, who are already facing high levels of maternal mortality, already struggling to make ends meet, that they're going to have to navigate the system to get care, or in some cases not get the care that they need. And we know, because of amazing research that has been done by colleagues like Diana Green Foster and her team, what happens when people can't get abortion care when they want it. That they're much more likely to live in unhealthy relationships and be subject to intimate partner violence, that they're more likely to live in poverty, that they're more likely to be unemployed, and that their existing children are also less likely to meet their developmental milestones, right? So we could be making policy decisions to make people's lives better, but in fact, we're doing the exact opposite here. And that is just honestly hard to get my mind around.
I still don't think I've processed the ruling in June, especially because growing up, I always knew that Roe v. Wade was a very contentious political topic. People have, at least from my experience, always brought up things like religion, healthcare, economics, patient provider. And there's so many different avenues people have come to within this topic very passionately. But even then, I don't think I saw the ruling being overturned as a possibility. And I don't know if that was just me blocking away what could be, or me being really naive. Even when the ruling had been leaked a couple months prior, I thought, okay, yeah, but this is just, an alternate, it's not like this is ever going to happen. And when you mention policymakers making policies that are really scientifically proven to have detrimental consequences to women and people that are already especially marginalized, it's interesting that you brought that up, because I often feel like it is so easy to pass a policy when it's just a bunch of words, but to know that there's research and anecdotes of how these policies affect the day-to-day lives of individuals makes these occurrences that much more heartbreaking, because you realize it's more than just words. It's more than just a ruling, right? Like, this decision is going to impact the trajectory of so many people. And I think when now as we're beginning this conversation, a lot of those unprocessed emotions and that grief is like coming back, thinking about it.
Yeah, I too, although like the guideposts were there, like we knew this was happening. And we could see this coming from years back. And in fact, in 2021, there were a record number of abortion restrictions passed at the state level, even before dogs, right? So like we have seen this trajectory where year over year, pretty much since Roe has been passed, there's been an increase in sort of state level abortion restrictions, right? Moreover, it was concerning that even the Supreme Court decided to take the case, given that just a few years ago, the whole woman's health case was decided and said that, there couldn't be restrictions placed on access to abortion that were an undue burden, to people accessing that care. So all of the signs were there that this was not going to be a good decision for abortion access. And I still felt the same way that you did. Like, there's no way they're going to do this because A, it just doesn't make sense. B, it's bad public health policy. And C, it's unpopular. Like the vast majority of Americans, regardless of their religious background, even regardless of their political affiliation, are in favor and in support of abortion access to some extent. So although like so much of my work has been preparing for this moment, sort of seeing these guideposts, I also felt similarly to you, where I was still like hopeful that it wouldn't happen. And yet here we are.
Yeah. And so as someone who's now in an executive position of a reproductive justice organization, have your priorities changed and how you are working towards reproductive justice as a whole? You were mentioning earlier that, there were these guideposts and you saw it coming, but you still weren't 100% convinced that this would be reality one day. So I'm curious to know how your work day to day has changed as a result of this ruling.
Yeah, thank you for asking. I mean, at Power to Decide, we're dedicated to improving reproductive well-being for everyone. And we do this by providing trusted resident information, mostly in the digital space. We do this by expanding access to quality care and services and through catalyzing culture change and normalizing conversations about access to contraception, sex ed, and abortion. And I think, our work is just more important now than ever. And so a lot of how we've pivoted is just doubling down, but also asking like, how are we using our resources to help people that have the most barriers right now and in the future, particularly thinking about the amazing tool that we run called Bedsider, which provides information about contraception, where people can access contraception, and lots of other information around sexual and reproductive health topics. And also through our website, Abortion Finder, which is the go-to resource and the largest database of abortion providers around the country. It also provides information about abortion funds, practical support organizations, and the legal landscape in every state. So we're, spending a lot of time bolstering these resources, and again, really applying an equity lens and ensuring that folks with the most barriers can access these tools and resources, and that it's providing resonant and relevant information for people who need it.
So now I kind of want to turn the conversation towards more of an ethical standpoint, because I know there's a lot of ethics and morals involved in this issue. I feel like a very popular argument is that, abortion can be an exception if the person was experiencing a sexual assault or a rape, and that to some people that might be the only acceptable reason for getting an abortion. But how does this view distort public perception of accessing different abortion services? And what are sort of the moral implications of that?
Yeah, I mean, I think, we've seen a lot of that in the media, particularly since the overturn of the federal protections for abortion and Roe v. Wade, as sort of people lifting up these extreme and terrible cases. And they are very real, but it sort of takes the light away from the fact that abortion is actually common, that 1 in 4 people in their lives who are capable of reproduction will have an abortion, at some point, and that every person's reason for having an abortion is compelling and important enough, right? And that we shouldn't have to turn to these extreme circumstances to justify an abortion. Like, people should be able to make these critical, important decisions for themselves and for their families, and should make those decisions in conjunction with their provider or whoever is important to them, whether that's a religious leader, their partner, their parent, their sister, their cousin. People should be left to be able to make those decisions in concert with those that are important to them, and not have to jump through a million hoops to be able to do it. But in practicalities, right, like having these restrictions often or these exceptions often don't work, right? I can tell you as a provider that in some states, for these exceptions to be able to take effect, that people would have to like go through the whole process of reporting to the police, right? And we know that people are very scared to do that and can have particular consequences, particularly in marginalized communities where people may not feel comfortable interacting with the criminal justice system or may not want to report their rape or their sexual assault. And so, in theory, it might sound like, okay, well, there are exceptions, it should be fine. But when you start to dive into the practicalities of it and how it works and the delays that it can cause for people accessing care that they need, it's really egregious and is really not a just system at all.
Yeah, you touched on some really great points. And what stood out to me the most is that wanting to access abortion services, every reason is compelling. And I think right now, especially with elections coming up, we see abortion being weaponized through the lens of ethics and morality and logistics, and really being used as a way to uphold a lot of politicians' platforms. And it is so painful hearing a lot of these campaign speeches or seeing what a lot of these policymakers stand for and having so many ifs or buts when it comes to accessing abortion, when it statistically, as you've mentioned, it's really common. And most of the time it's not limited to just experiencing assault. And I think what's even more painful is realizing that most of the people that are making these decisions or making these comments are people who don't have the capacity to carry a child. And, I'm from Georgia, and recently there's been so many scandals with Herschel Walker and how he has this very anti-abortion stance, although he himself has been proven to pay for these services and have them taken up. And I think coupled with these commentaries, we've seen a lot of ongoing rulings at the state level too, since the Supreme Court rulings. Arizona has come up a bunch. Lots of states have pulled trigger laws. In the midst of all of this, I think really the biggest question is, how can individuals access the reproductive care that they need? I know earlier you've mentioned a lot of the resources that Power to Decide and a lot of organizations provide that you are familiar with, but we want to ask from really a person from anywhere, how can they access the reproductive care that they need?
Yeah, it's a great question. The great thing is that there are many amazing organizations, some led by volunteers, some led by folks who do this work every day, who are working on the ground to sort of help people connect to care and services. We do that at Power to Decide through our website, abortionfinder.org, which again is a comprehensive searchable database of providers, and we include state-specific guides to help people understand what the laws are in their state and the range of support organizations in each state that can help people connect to care and services. And we include telehealth providers, which is increasingly becoming more popular for a way for people to access medication abortion in their own community. And folks are galvanizing, right? And sort of getting the funding provided to connect people with care and services and help people travel from Texas to New Mexico or other states. But it's really hard. The New York Times just published an article last month about the increasing cost of abortion care. And some of the cases that they reported on showed that people are spending between $3,000 and $10,000 for abortion care, oftentimes even just in the first trimester, right? When you calculate the cost of the abortion care itself, plus the cost of travel to that care, perhaps the cost of stay, depending on if there's a waiting period or the protocols for the provider. And for many people, young people with lower resources, $3,000 to $10,000 may as well be $100,000. It's just not navigable. Right. And so there is the risk that despite all of the galvanization, despite all of the funding, despite all of the resources being put towards this, that many people are not going to be able to connect to the care and services that they need. And again, that's just heartbreaking, knowing the research around what will happen to those people and to their children and to their communities.
Yeah, it must be really frustrating trying to figure out all of the policies in your individual state they seem super confusing. And then if you move to another state or you have to travel for care, then that's a whole other set of policies that you have to learn. And that just seems like a nightmare. And so something we were wondering is if emergency contraceptives have become more popular due to the stress and confusion of learning all these new policies and regulations. Do you see things like Plan B or other emergency medications having a shortage in the near future? Do you think a lot of people are going to start stocking up on those things?
Yeah, I mean, we have seen increased searches on our own website, Bedsider, for contraception writ large, more information on emergency contraception. In the wake of the Supreme Court decision and the leak, there have been reportedly spikes in demand for birth control from a number of telehealth providers that have said, hey, like we're seeing huge increases in demand for our services. So I think this is happening. And interestingly, people are also searching more for information about permanent birth control, vasectomy for people with penises, and tubal ligation for people with uteruses. So, people are nervous. I think, any opportunity to talk about contraception for people who want it is great, but I don't think that people should be forced from fear into making decisions about, like, do I need emergency contraception or contraception, right? We should be envisioning a world that is ideal, where people have access to quality reproductive services, including emergency contraception, other forms of contraception, IUDs and implants, and abortion care should they need it, both medication or in-clinic abortion, from a quality resource close to them in their own community, not having to jump through a million hoops, consider not paying rent for a month, or, having to leave your children for a few days to go out of state, right? We should be envisioning a world that focuses on improving people's reproductive well-being. So again, I appreciate the opportunity to sort of like lift up the fact that birth control is available, it's safe and effective. But I'm also sad, that so many people are really fearful that it's going to be so problematic if they get pregnant and they're not ready to be a parent, for them to navigate abortion care, that they're sort of being shamed or feared into accepting contraception.
Yeah, even with contraception, I feel like there is so much misinformation for what contraception is and what it isn't. I think growing up, I've heard so many people tell me that contraception is going to cause XYZ. If you are infertile, once you get off the pill, it's because you took the pill to begin with. If you gain weight or have acne, it's because of the pill, or, the pill is toxic. You need to regulate your hormones naturally. There's so much misinformation on it. And I think one question that really popped up is, for someone who is overwhelmed with knowing what contraception option is the best for them, or, they're on the internet and they come across tons and tons of articles, what is the best first step? And I think initially it's like, oh, well, you should go talk to their clinician. I think I am asking this question because I remember, out of curiosity, when I had first mentioned the idea of contraception to my physician, it must have been 16 or 17, just because I really just wanted to know. And I was told, you're too young to know about this. And I was like, oh, okay, I guess I'll just keep these questions to myself. Reena, I guess I'm curious what your experiences have been with healthcare providers kind of close to this age range, when I guess topics of contraception and safe sex and reproductive rights are first kind of introduced to us. Did you have similar experiences to me, unfortunately, or were they a lot different? I'm curious to know how you felt in these moments too.
Yeah, I guess my experiences have been pretty neutral. I've never had to talk to my provider about going on birth control because I personally don't need it. But I do remember those times when my doctor would ask my mom or whoever was with me to step out of the room so she could ask me if I'm sexually active or something. But luckily I've never had any, I guess, pointed claims that like I'm lying, because I know a lot of people have experienced that, unfortunately. But I think it's important how, maybe outside the realm of clinicians, like how our own families view the idea of contraceptives. I remember bringing the idea up to my parents. Oh, maybe I should consider birth control, because I was having some pretty weird symptoms like every month. So I'm like, okay, well, if I don't want to deal with this, maybe I should take birth control. And they're like, no, why would you do that? Birth control is only if you're trying to not get pregnant. that is true, but there are other things to it too. So I think in general, there's just a lot of misinformation and not a refined level of understanding of what birth control and other contraceptives can do.
I'm so glad that you brought in this family perspective, because I remember birth control was first introduced to me when I was 14 or 15. So I was really young. And it was because I was diagnosed with PCOS and Hashimoto's and hypothyroidism. So I just had a lot of hormonal imbalances. And my provider to my mom and I was like, oh, a lot of girls who experience these disorders and these symptoms like to go on birth control to keep their symptoms in check. And my mom was like, no, why would you mention this to my 15-year-old daughter? I don't feel comfortable. No, no, no. And I think I understand, because from a cultural perspective, I think my family is a lot more conservative and matters related to contraception. But I think I regret that my provider didn't feel the need to explain that the birth control pills would be used to alleviate symptoms. Because as soon as my mom freaked out, the provider was like, okay, yeah, well, we don't have to do that. That's fine. And I was like, what? Well, why'd you mention it if you weren't going to talk about it? And it wasn't until I think I graduated high school that my provider really explained everything to my mom, what it was doing, why it's helpful. And it helped shift my mom's perspective. But this could have been done 3 or 4 years ago,
Yeah, that's really frustrating. I hope that doctors and just families in general can feel more comfortable talking about these things and just opening up the conversation for it to even be a thing to talk about, because this is really important. But yeah, now I want to take it to Dr. Raegan, and I'd love to hear what your thoughts are on anyone who's looking to access contraception.
Yeah, I'm so sorry that you had that experience. Everyone deserves to have a resource that they're comfortable with, that's affirming and sex positive, that they can talk to about these issues. But recognizing, unfortunately, that we don't have nationalized standards for sex education, and we don't have the same resources for access to contraception in every community, because many communities are focused on sort of an abstinence only framing, that we are committed to providing this information through our digital tools like bedsider.org. So on there, we have a really great resource that goes through all of the different contraceptive methods, and people can learn more about each of them, the risks, benefits, side effects, to see if it works with their lifestyle or not. We also have a clinic finder, so people can find providers in their own community that provide birth control. And for people who want birth control pills, we have a partnership with some telehealth companies to provide a year's worth of contraception delivered right to your door, to your local pharmacy, at no cost if you can't afford it yourself or qualify. That's our BC Benefits Contraceptive Access Fund that seeks to provide contraceptive access to folks with lower incomes, which is one great service that we provide. So definitely check out Bedsider, play around with our method finder. There's tons of information there about other sexual and reproductive health topics. And then you can link to a provider either through our telehealth connections or an in-clinic provider with our clinic finder, to make sure that you get the care that you need. And if ever you feel like someone, the provider that you're talking to, is condescending, is not listening to you, is not listening to what's important to you about your birth control method, you have the right to just say, you know what, this is not working for me, and look for another provider. You never have to sort of to just compromise with low quality care that's not person-centered.
Yeah, thank you so much for providing us all the resources. Because when Rena and I were first thinking about creating an episode around this topic, our biggest goal was to have our audience walk away knowing what websites they could go to, how they could connect to telehealth providers for contraception and other pieces of information. So thank you so much for sharing that. I think before we get on to a couple more questions, I'm so glad that you mentioned the idea of person-centered care and patient rights, where patients are able to walk away, because I think that's something that's not talked about often in healthcare, right? That as a patient, you have the power and the right to walk away from any provider that isn't serving you or respecting you the way you need to be. And I think it's sad that this kind of trickles into education too. Earlier, you were touching on abstinence only sex education. And again, another memory, my high school sex education was abstinence only, like most schools. And I remember we were covering STIs, and that was like the last module. And at the end of the module, we all got abstinence certificates, and you signed. And by signing the certificate, you promised abstinence until marriage. And one student in particular was like, I'm not going to sign this. And our teacher was like, why aren't you going to sign this? Are you going to go have sex right now? And the student was like, well, I can't promise you abstinence because I don't know. Like I'm only in high school. And our teacher looked at everyone in the class and goes, if you don't sign this certificate, I hope that you get an STI. And I must have been like 15 at the time. And I didn't really process it out. I think when you're 15 and you hear something really uncomfortable, you're like, I mean, I think I'd do that right now too, to be honest. But, I think about that now and I'm like, what an awful thing to say. And I cannot imagine the content of sex education now, especially with this ruling and what is going to be taught to children. And it really does scare me that we are going to have students or people walking around without sex positive education because they truly will not know how to navigate scenarios.
Yeah, it's really interesting how sex education is just so different across not even different states, but different schools. I remember my sex ed in middle school, it was way too in depth for anyone to understand. They were showing us anatomical pictures, diagrams, and we're all sitting there with blank eyes, not knowing what's going on. Whereas education in high school was really different because that was targeting more behavioral actions, right? Like, you guys need to use condoms. Here's how to put them on. We had to learn that. We learned about STIs as well. But there was still a pretty big emphasis on abstinence. Maybe not as far as you, Fatiha, where we had to sign a contract, but that was still definitely a thing that we were learning. Like, oh, if you don't want an STI, you need to wear protection or you need to just not have sex at all. So I think it's really interesting how different schools approach it. I don't know if there's a method that's better than the other, but I definitely think that there's a lot of politicization behind all of this as well.
That is so awful. I'm so sorry that happened to you. And it's not evidence-based, right? Like, we know from research that abstinence-only sex ed does not decrease someone's, likelihood of initiating sex or having sex, or and actually increases the risk that someone might have a sexually transmitted infection, right? Because when we give people information about how their bodies work, what a healthy relationship is, how to navigate consent, condom use, what STIs are, which ones are treatable, and how to get care for it, then they are more likely and have the tools to make healthy decisions, right, for their bodies and their lives. And so, again, we can re-envision a world where we're providing all of this information in an age-appropriate way from a very young age, just talking about consent and touch, what the body parts are, what their actual anatomical names are, so that when they, get in a relationship, they know how to communicate, and they know how to protect themselves and to have a healthy relationship. So that's the world that we should be working towards. But to your point, we're going in the opposite direction right now, right? And we're increasing the amount of fear for people, even if it's not actually related to these laws. So, for example, when the SB 8 6-week ban was first passed in Texas, which really just sort of talks about fees and restrictions and issues for providers, but not for the people themselves who have abortions. There was someone who was arrested, at least briefly, in Texas for having an abortion until the attorney general in that area realized that the law did not apply to this circumstance. And so, while we know the real world impacts of not being able to access abortion care, I think what we don't yet know are sort of all of the trickle down effects of people just being scared to talk about it, right? The sex ed teacher in, high school who might, have at least broached the issues of contraception and abortion with their class might be worried now that these laws apply to her, even though they don't, right? And the same thing is happening for early pregnancy management and miscarriage management. Providers are afraid to sort of do that work or are concerned about when they can intervene and when these laws apply. And so there are, significant chilling effects and fear that is going to have widespread consequences that it will take years to really fully understand the impacts of.
Yeah, I really think this fear of prosecution or fear of the law is going to become more prevalent now than ever. And I can imagine that is a problem for providers as well, right? You might have a doctor who can really tell that an abortion would be extremely beneficial for a patient, but then they feel too afraid to treat them. And that seems really awful. So I wanted to get your thoughts on how you feel about doctors who now have to gather their lawyers to make every decision, right? It just seems so inefficient and time consuming and just totally not effective for the interests of patients.
Yeah, and it's not good medicine, right? Like as providers, we're trained to provide best practice medicine. We have professional organizations that give us guidelines to do what we're trained to do, right? And we follow those professional guidelines to provide the highest quality of care possible. But now we insert these laws, and instead of being able to do what we're trained to do, and we know what is best for patients, or at least have those discussions to say, this is your clinical situation. It looks like you're having an early pregnancy failure. These are your options. We could intervene. We could intervene with medication, or we could intervene with a procedure, or we could do nothing and see what happens. What would you like to do? Right? Like that is good practice. That's good medicine, and person-centered care to sort of provide all of the options, to discuss them with your patient and decide, and they can decide for themselves what they want. But now those conversations are being taken out of the hands of providers and their patients. And we're inserting lawyers and legal counsel to say what can be done and what can't be done. And that's causing delays. That's causing people to have to wait to what is seen as life-threatening circumstances, which is not black and white. It's not like 1 minute it's clear that somebody is safe and the next minute they're unsafe. And it's really frustrating and causing providers to have to sort of make decisions that could potentially put their medical license at risk because they're not able to provide best practice medicine, or be at risk for criminal charges for violating these laws. It's a terrible situation to be in. And I do not envy my colleagues in these states. I feel awful for them. But more importantly, I feel awfully awful for the patients, right? Who they're coming to us because they just want to be taken care of. And oftentimes they know what's best for them and what they want. And it has to be absolutely infuriating to feel like your provider cannot provide the care that you want or need because these laws are in the way and impeding them from being able to do that.
Yeah, I think time and time again throughout this conversation, it's been really difficult to imagine all of the policy implications on a specific patient. We've talked about at the end of the day, it is patients that are being left behind and are being left in circumstances where they most likely won't even have further access to take care of themselves. We were talking about implications to existing children, to family members, to community services. And it's really hard to even articulate the grief that someone must be experiencing for being forced to carry a child just because of some moral policing that really isn't even rooted in reality. And by reality, I mean the science and the public health research that we have years of to understand. I know that we've touched on a lot of implications and a lot of resources, but I think for the final segment of our podcast, we want to address, for our listeners that want to take a more active role in protecting reproductive rights and want an active role in working within reproductive justice, what are some actions they can take or movements they can be a part of at this moment?
Yeah, great questions. I mean, as we discussed, the need is great right now for people to be able to travel long distances. So connecting with the National Network of Abortion Funds, finding what abortion funds are active in your area, donating to those funds, seeing if they have opportunities for volunteers. There's also apiary practical support organizations that are helping people to connect to care and services and helping them navigate all of the travel that they need to do to get from one state to another. That's another organization to look at. Of course, supporting us at Power to Decide and Abortion Finder. We would love folks' support there, as well as just spreading the word and letting people know what these resources are. And that's why the work that you're doing on this podcast is so important, because there is so much misinformation out there. And we want to make sure that people are getting access to trusted, important, evidence-based information, whether that's Bedside or Abortion Finder or other trusted partners in our ecosystem. So lifting up visibility about these resources is critically important. We were super excited that the federal government created a new website called reproductiverights.gov to inform people about their reproductive rights and where they can access care and services. And they linked to abortionfinder.org for access, for information about abortion access. If you're interested, we have stickers with a QR code that people can scan to link them to abortionfinder.org. They're free. Just come to our website and let us know how and where to send them to you. And you can post them all over your campuses, in bathrooms, at restaurants, wherever you think people might need this information. But the more we can do to get this information out there, the less likely people are to, fall through the cracks, not be able to get to not be able to connect to the care and services that they need, or even worse, to connect to misinformation, crisis pregnancy centers, or misinformation online, that's sort of encouraging them or pointing them towards resources that could be detrimental or giving them bad information.
Yeah, I'm really glad you're able to list these resources for us, because I think they'll be extremely helpful and our audience will be well informed. And I know with issues like this that involve the Supreme Court or higher levels of the government, us individuals can feel pretty powerless sometimes, but I'm glad to know that there are a lot of organizations who are actively working on this and that are able to take in volunteers or donations. But to close, we kind of want to take some time to step outside of the realm of abortion and to ask what lessons you've learned from working in reproductive justice in the US and even maybe globally. What are some moments or observations that have left a lasting impact on you?
Yeah, I'm so glad that you asked that. And I think, one thread that I'm pulling from this conversation is around stigma and shame, right? Fatiha, you told a few stories from your childhood, harrowing, terrible stories that no one should have to go through. But it's all rooted in shame and stigma. And I've had the opportunity to travel as a high school student to spend a semester in Paris, where I was amazed that sex was talked about so openly with high school students. The family that I stayed with lived in a suburb of Paris, and they had a little apartment, a flat in Paris. And they had two young girls in their family. And when we went to the flat to crash after a night of hanging out and partying, there was a bowl of condoms on the table. Now, my family was progressive, but they weren't that progressive. But just to see there was a different way to do this, and we can have conversations that aren't permissive, but are encouraging people to make good and healthy decisions, was really eye-opening. Similarly, I've had the chance to provide reproductive health services in sub-Saharan Africa and other places. And it was really refreshing to be in cultural scenarios where abortion was not super stigmatized. There were things that were, so, sex out of marriage or young people having sex, certainly stigmatized, but the idea of abortion itself was not stigmatized or applied the moral framework that it often has in the United States. And that was refreshing. So I think it's important to know that this can be done differently. In many places, it is done differently, and that our young people deserve better. And, you asked at the beginning how I was feeling, and I said hopeful. And I think in part, I'm hopeful because now people are having conversations about abortion who never had them before. The prominence of this issue in the media cycle, the prominence of this issue in the workplace, people who run companies are having to think about, if I live in a state where abortion is restricted or banned, how do I support my employees? And so that gives me hope that we can sort of push through this and combat this pervasive stigma and shame around reproductive health writ large in this country, including abortion. And that will get us to a better place. And it's going to take some time. This is not going to be an overnight fix, but I am hopeful that we'll get there. And the fact that you're having this podcast with your listeners and talking about these issues gives me hope as well. So thank you for the opportunity.
Yes. And thank you for making the time and for being willing to educate us and our audience on this topic. I feel like, especially you're mentioning, abortion is having a lot of attention in the media cycle, which is good because a lot of conversations are being had, but that also gives us more scope for misinformation. So to have an expert address a lot of sources of misinformation and give our audience tools and action items to work with is wonderful. We hope that this episode empowered you to understand aspects of reproductive justice and how to take actions within this movement. For more information about this episode and to read further about this topic, please visit our website withthepodcast.wordpress.com. To share your thoughts and to interact with us, follow us on Instagram at withthepodcast. We appreciate your support, and thank you to Dr. Raegan for taking the time to talk with us. We hope you will join us for our next podcast episode.